If you are pregnant, listen up because there is an upcoming live pregnancy workshop available to help you prepare your body and pelvic floor for birth and beyond. We discuss ways to reduce risk of perineal tears and episiotomy. We learn how to reduce risk of pelvic floor trauma and, importantly, ways to support a strong postnatal recovery. This free workshop called Birth Strong is physio-created and designed to help you feel more confident and empowered about your upcoming childbirth experience. Head to fitnessmama.com/pregnancy workshop and the link is in the show notes. Once more, that's www.fitnessmama.com/pregnancy workshop, all one word. Can't wait to see you there. If you are pregnant or you've recently had a baby, this podcast is for you. I am your host, Kath Bequee, a physiotherapist working in women's health and mum of 3. Inside my online program, Fitness Mama, I just love helping support women to care for their bodies during pregnancy, prepare their bodies for birth, and support their after-birth recovery, helping them feel confident and strong inside out during this important stage of their lives. In this podcast, join me each week as we dive into all things pregnancy care, childbirth, and postnatal recovery, helping you through every step of the journey. It is absolutely possible to feel amazing and confident in our bodies during this motherhood journey, and I want that for you. Come and say hi to me on Instagram @fitnessmama, and let's dive into today's episode. Hello and welcome back to the Pregnancy, Birth and Recovery podcast. Today's episode is perfect if you have a new baby or an older baby or a toddler, because I am chatting with Nicole Gleeson, who is a clinical nurse specialist at the Royal Children's Hospital, and she's also founder of Rhythm First Aid, which is a training company based in Victoria. So in today's episode with Nicole, we discuss all things newborn fever, so things to be aware of if your baby has a temperature. We discuss how to measure the temperature. We discuss everything from what is a temperature? What are the best thermometers to use? When should we take our baby to hospital, to the emergency? And we also cover the breathing aspect a little bit at the end in terms of what do we look out for with the baby's breathing. So it's a really great episode. It's one I wish I had access to when my first baby was very little. And as Nicole mentions in this podcast episode today, there is sometimes a lot of misinformation around fevers and when to admit to hospital. And sometimes we're measuring our baby's temperature inaccurately, and then that can impact whether or not you take them or you don't take them to hospital. So I think today's episode, if you're pregnant or you've got a baby, I really think it's a must. Nicole is a wealth of knowledge, and it's a fabulous episode that I trust you'll get a lot of value out of. Before I do jump into this episode, I just want to invite you to come and join us inside Fitness Mama. If you've had your baby and you're feeling weaker than normal, you're not feeling as strong, if you want to reclaim your pelvic floor and core and strength safely, then this is available with our 7-day free trial. Perhaps you found you're not exercising as much as you'd like to now that you've had your baby. Perhaps you've got aches and pains. Perhaps you've got abdominal muscle separation. Perhaps you want to get back into running and you want the best Kickstarter possible. Then Fitness Mama could be exactly what you need. So join us for these convenient, short, easy, quality workouts created by physio that you can do from the comfort of your home whilst your bubba kicks around on the mat next to you, whilst your toddler runs around, or at the end of a long day at work. So head to fitnessmama.com and the link is in the show notes. Right, let's get into this episode today with Nicole. Nicole, thank you so much for joining me today on the Pregnancy, Birth and Recovery podcast. We're discussing all things newborn first aid, but in particular fever, checking temperature, all the good things, and not good things, not so good things, but in terms of, I think this is a really common concern for new parents. It's a bit of an unknown when you have a baby and then suddenly they get their first fever, and it can be a bit scary. So thank you for joining me today.
Thanks, Kath. Thanks for having me.
How did you get into this area of first aid?
Yeah, so my background is that I'm a paediatric nurse. So I've worked as a paediatric nurse for over 10 years now. I've worked in a couple of different areas within paediatric nursing. Most of my work has been in emergency, and we see a lot of patients, so children and babies that parents present with them to the hospital every day with fever as a presenting problem. So we know that it's a huge burden of disease within our population. And the way that I got into first aid, or the way that I got into babies and children's health, is through my role working at the hospital and seeing that there was quite a lack of education in the community. When parents bring their babies to hospital, we spend quite a bit of time educating them, teaching them, but wanted to create a business and a place where people could go and learn about the health of their babies.
Yeah, and in terms of fever, for example, newborn fever, I can imagine, or not just newborn, but baby and toddlers, I can imagine this could be anything from quite a mild issue to the other end of the spectrum where it's quite a serious issue.
Yes, that's correct. So there's a couple of different factors, I guess, when thinking or speaking about fever. A couple of different things I think we should talk about separately is the sort of newborn population, because if a baby under the age of 3 months has a fever, so a fever is a body temperature over 38 degrees Celsius. So if a person under the age of 3 months has a fever, then that's a different set of rules to a baby that has a temperature when they're over 3 months of age. And if someone had any specific medical conditions, or if they're immunocompromised, they also have their own set of rules as well. If someone was more vulnerable, or your doctor has told you otherwise. But generally speaking, if a baby under the age of 3 months has a fever, so a body temperature over 38 degrees Celsius, then the recommendation is that they need to be seen by a doctor or be taken to an emergency department as soon as possible.
Right. And in terms of checking that, because I want today's chat to be very practical for parents. So in terms of if you've got an 8-week-old bubs, what's the best way to check, or most accurate way to check their temperature?
Yeah, so the best and the most accurate way, and the only way that you should really be checking a baby's temperature, so an 8-week-old in your example, Kath, or up into that sort of at least 3-month population, is an under-the-arm thermometer. So it's one of those old school, quite simple looking thermometers. It's got a tip on it. It's got a digital screen on it. And you hold that thermometer underneath the baby's arm, and the thermometer might beep, but it's also important to hold the thermometer under there until the numbers stop going up, and then reading the number on the thermometer. So if it's 38 and above in that 8-week-old, then you need to quickly pack a bag and take them to your doctor or take them to your emergency department. And if the temperature is below 38 degrees, they might still be unwell, or there's something maybe bothering them. There's something that's prompted you to check their temperature. But yeah, rule of thumb, temperature over 38 degrees Celsius, always, always, always check by an under-the-arm thermometer. It's the most accurate way. Forehead thermometers are the least accurate way to check a baby's temperature. They're not, I know, it's quite surprising. And in fact, in 2021, 2/3 of babies that presented to the emergency department with a fever, 2/3 of parents had used an infrared thermometer on them. And yeah, they're highly inaccurate, which is...
You know why that is probably? Is because when I first needed to go and get my thermometer, off I go to the pharmacy, and you want to get the best thermometer, right? So you end up, well, I know I ended up spending quite a lot of money on a forehead thermometer versus a simple underarm, which was a fraction of the price.
Yes.
If I'm remembering correctly, it's been a few years, but then I remember putting this forehead thermometer on my newborn that's obviously their head's moving around, they're not staying still. It was really hard to get a reading at all.
Yeah, and it's like you said, you sort of think, oh, I'll pay that extra. I want this to be accurate. This is really important that it's a piece of medical equipment. I want to get a good one. And you might pay upwards of $100, $150 to get this thermometer. And then you come into the hospital and we say to you, oh, no, don't use that thermometer. That's not accurate. You need this $15 under the arm one. And parents are mind boggled. They're like, what? I just spent all this money on a thermometer. And this is one of the many reasons why I've created Rhythm First Aid to help, disseminate this accurate information from inside the hospital and from our experience, working on to try and help parents, to try and empower them and to try and decrease their worry and give them strategies when their babies are unwell.
Yeah, amazing. And just one more question about checking their thermometer, checking their temperature. I would always pop it under the arm, I hear it beep, check the temperature, but then I'd try it up to 3 times to make sure the temperature didn't keep increasing, because often it increases a bit. Is that the right thing I did? Is just keep checking that temperature until it stabilizes?
Yeah, look, there's no right or wrong. I mean, a fever's a fever. If the temperature's over 38 degrees, you don't need to keep checking it. Myself, as a mum, checking my baby's temperature over the last couple of months when he's felt hot, like he's been radiating heat, I know he has a fever before I even check I know he has a fever, before I check his temperature using that thermometer. But I just checked it once. He had a cold, he had a snotty nose. Turns out he had a respiratory virus, go figure, in winter. But to me, I didn't really care what his temperature was. He had a fever. It doesn't matter if it's 38.5, it doesn't matter if it's 39.5, 40.5, 41, because the severity of illness is not dictated by the number on the thermometer. So just because his temperature was 41 degrees, it doesn't necessarily mean that he's any more unwell than if it was 38.1.
Yep, okay.
Under that 3-month age group where we really want to monitor their temperature. And when I say monitor their temperature, usually the baby will be irritable in that age group that will prompt you to want to check their temperature. So above a 3-month-old, so like you were saying, checking the temperature 3 times, you absolutely can do that. And my experience professionally is that parents will almost always know when their baby's about to spike a fever before they do. I cannot tell you the amount of times that parents have said, press their buzzer, and I've come in and said, hey, Nicole, can you check so-and-so's temperature? And I check it and it's, 37.7. I said, I bet you in half an hour it will be over 38. They'll have a fever because, parents are just so in tune with their babies and they seem to feel hot. So, it's certainly not necessary to check 3 times. You can just use that as a guide. And we don't encourage you to be constantly checking the temperature as well, because it's more important for you to be assessing and looking out for other symptoms of your child's illness. So we want you to be keeping an eye on their breathing, their behaviour, their hydration and their wet nappies and that type of thing. Like a fever, that high body temperature is only one piece of the puzzle, if that makes sense.
Yep. Okay, I'd like to go into what you just said a little bit more, but I do have one more question about the baby under 12 weeks old. Why is it so important to take them, did you say to a hospital or to a doctor?
It depends on your situation, but if you've got an under-the-arm thermometer and the baby's got a fever over 38 degrees, I would just take them to emergency because you're probably going to end up there otherwise.
Okay.
Depending on your situation, if you've got, a GP that you're quite close to and that you're able to get a last-minute emergency appointment, then absolutely you could go there. Just depends, on your situation of where you live and that type of thing. You could do either.
So why is it so important to go to the emergency department with a baby under 12 weeks old compared to if they were over 12 weeks old?
Yeah, great question. The reason why is because their immune system is quite immature and underdeveloped, and they're such a vulnerable population. They can get sick quite quickly. And the reason why they need to be seen by a doctor or need to be seen in the emergency department is we want to find out why they have a fever. So now babies get sick. We don't like when they get sick, but it happens. And what we want to know is why they have a fever. So where the infection is in their body. Is it a virus? Is it a bacteria? Do they need antibiotics? So what the doctor will do and what will happen in the hospital is that we will complete a range of tests, blood tests and urine tests. We're trying to find, do they have a cough and a runny nose? Is it likely a cold? Do they have a urinary tract infection and that type of thing. But the reason why it's that 12 weeks sort of rule is because they're little, they're very vulnerable, and they've got immature immune systems, and they can become unwell really quickly as well.
Okay. That's good to know. So now, was there anything else you wanted to say about babies under 12 weeks old before I start to quiz you about over 12 weeks?
I think so. I think a lot of people have forehead thermometers and have ear thermometers, and you can use them, but just never trust them. And then, so I think if you've got them and they're not accurate, then sort of some people say check them babies when they're sleeping, their temperature, but you don't need to do that. Like, why are you up checking your baby's temperature? If they're uncomfortable, they'll wake up. So, and I just want to say, don't be too disheartened if, you've put it on your baby registry or someone's gifted you one and you've bought one of these expensive thermometers. Lots of people have. You're not alone. 2/3 of parents have. But we just want to really try and discourage the use of these thermometers, definitely in that early population. And the reason why is because, you might check their temperature with a forehead thermometer. It's 38 degrees, so you head off to the emergency department, and we can't take any risks. Like, you've got a measured fever at home, so we have to then do all these blood tests and these things. And the study that's been done, that 78% of the time it was inaccurate. So 78% of the time we doing blood tests and giving IV antibiotics when it may have been avoided if someone had to have told these poor parents about the correct thermometers, which is why about it so much, because I'm the nurse that's helping with the assessments of this tiny little baby. And yeah, it's heartbreaking.
Yeah. Okay. So over 12 weeks now, they've got the same temperature that you mentioned, but you don't need to quickly rush them to the hospital. So instead, what are the things we're looking out for? What do we need to be aware of? I know you quickly went through the list. Yeah. Let's go for it.
Yeah, great question. So first and foremost, it's really hard, and I sort of am hesitant sometimes saying about following your gut, following your intuition. And I know, as a new mum of less than a year myself, people bang on about it. And it's kind of like, what even is that? Like, am I just anxious? Am I overthinking it? Am I too relaxed? And that sort of developed with time, but it definitely is there. I remember listening to someone saying, what intuition? Like, where does it come from? Like, how does but it definitely is there. And I've never met a parent that's been wrong about the way that their baby is feeling or what they think when they think there's something wrong. So first and foremost, following that and trusting that you have the intuition and that you know your baby. Second of all, the three sort of things that we are always assessing and keeping an eye on, or the three sort of pillars, are their behaviour. So is your baby really lethargic, really flat and difficult to rouse, or are they really irritable? They're so hard to settle. That would be, I guess, a red flag or a reason to see a doctor. Another reason would be their breathing. So if they're breathing harder and breathing faster than normal, and you're worried that they're sucking in around their neck, sucking in around their ribs. Another indication would be their hydration levels. So as a generalized rule, we say that if your baby is drinking less than 50% of their normal fluids, so having roughly less than half of their normal breast milk or their formula, and then again, if their nappies are roughly less than 50%, then that's an indication to see a doctor as well. So those sort of three things is what we want you to be assessing and what we want you to be keeping an eye on when your child is unwell. A few other things, I guess, that you would say are red flags and when you need to see a doctor is that one of the main things is a non-blanching rash. For those of you that might be unfamiliar with a non-blanching rash, that is when the rash is often like purple or red spots that are on the skin, and when you run your finger over the rash, it doesn't disappear. So the easiest way for your listeners to think about that, and the way that I explain that in a first aid course, is think about a freckle on your arm. And if you have a freckle, it's safe to do so if you're not driving, push on the freckle and check if it blanches. And what that means is a freckle, for example, wouldn't blanch or wouldn't turn white or to your normal skin colour. But if you had like a sunburn or something like that, it would turn white. Hopefully that makes sense. Really glass and roll of glass over the skin. So a non-blanching rash is a bit of a red flag, or is a red flag as well with the fever. But yeah, they're the main sort of things. The things that we want to know as health professionals, and that I'd be thinking about as a mother, is, why does my baby have a fever? So you're on the hunt, you're looking out for symptoms. So are they vomiting and have a fever? Because a baby that vomits and has a fever, it could be an indication that they have a urinary tract infection. Do they have vomiting and diarrhea? Well, if they do, it's probably gastro. Do they have a blocked nose and a cough? Then it's probably a cold. If they're pulling at their ears, do they have an ear infection? Are they crying when they're swallowing? Do they have a red throat? All of those types of things. So sort of trying to look at the bigger picture when your child is unwell and when they're over that 3 months of age. And the recommendation is to see a doctor if your child's had a fever for greater than 48 hours as well.
So I know this is probably going to be hard for you to answer, but let's say your baby's woken up from their nap and you've noticed that they're irritable, they've been a bit fussy during the day, not really feeding very well. Like, let's say they've got 2 of those lists that you mentioned, or I guess my question is, if they've got some of the symptoms but not all of them, like at what stage do you then consider, okay, I need to get help here?
If you're ever in doubt, if you're not sure, if you're like, oh, I don't really know what's going on, I don't know why they're fussy, I'm not sure, then absolutely make an appointment with GP. Go and get that peace of mind. Go and have your baby assessed so you can have a quick top to toe. You can have a chat with your GP about things you need to keep an eye out. They'll reiterate the type of conversation that we're having today, that to keep an eye on these things. They might say to you, I want you to come back if your child's not drinking more than 50%, or if you notice X, Y, and Z. I think particularly depending on your experience as well, if it's your first baby and, it's their first couple of illnesses, you're not used to this and it's really scary and you sort of don't know what's what, versus if you've had multiple children, they've been sick multiple times, you've got more practice, you've got more confidence, you've done it before. As you said, I'm giving a very ambiguous answer because it is very ambiguous depending on the situation, but that's what GPs are there for, to help support you through this. You're never supposed to be alone. You don't want to be, in a dark room in the nursery Googling things and you're so stressed. If you're doing that, just stop and think about get some help here.
Absolutely. And I can attest to what you just said. With my first bubs, I went to the GP so much more than my third baby because I did have that level of, I guess, experience and confidence and knew, when I won't mention that I sometimes probably waited too long to go to the GP, but no, you definitely do change. But also, having said that, I do remember with my first bubs, sometimes I felt it was the best money spent, even when they said nothing. Like they said, your baby's fine, just keep an eye on them. And I remember thinking, oh, I feel so much better, rather than I could have been worrying for the next 24 hours. And so sometimes it is the best money spent to take them to the GP just to get that reassurance.
Fine. And for your mental health, and I say that to parents as well, if you're going to be up all night, you are so stressed about your baby, then please do a virtual ED or get a late night GP or go to your urgent care. Try and get the help. You've got to look after the baby the whole next day as well. It's just, you don't need to be so stressed at home. People that can help you and support you through that. Like you said, just do a quick assessment and say, I'm really reassured by their ears are clear, this is happening, they're drinking well, these are all the good things they're doing. I want you to come back if these 3 things happen, and they're nice and clear that you've got a plan, you can have that peace of mind.
Now, for the listeners who are in Australia and Victoria, can you quickly mention a few of those resources? We've talked about going to see a GP. There's a virtual ED.
Yep.
What are some other resources?
So in Victoria, there's something called the Victorian Virtual Emergency Department that you use on your phone. So you need a device that has a FaceTime capabilities, and you go into the Victorian Virtual Emergency Department website, and it'll prompt you through what to do. You go into a virtual waiting room where you'll see a doctor. They can send scripts and things like that as a text to your phone, which is an amazing resource for those in Victoria. Depending on,
I've used that before. It was amazing. It didn't have to leave the house. It was just amazing.
Yeah, they are phenomenal, aren't they? So I've also used that for myself and for my baby, and could not recommend anymore. In Victoria, there's also things called priority primary care centres. They provide GP-led care to people who need urgent care, but it's not quite like that full emergency response. depending on where you live, I live in a small country town, so our emergency department is quite far away, but we have an urgent care at our hospital. So you might have an urgent care. If you're in a metropolitan area, you might be able to access a doctor to come to your house via 136 or similar to that. That's just specific for Victoria. I know that some other states do have virtual emergency departments and virtual doctors as well. There's also some private clinics that you can access as well, such as like All and Cub Care and things like that, that you can FaceTime a paediatrician or an emergency doctor as well.
And there's some nurses on call as well, aren't there?
Yes, there are. So there's the nurse on call phone number, which are fantastic. Nurse on call are great. Often, if you need a little bit of help, you're not really sure what to do. And the same there's a maternal child health line as well. Can't remember either of those numbers off the top of my head, but they'll come up if you search them in Google. They are both also great resources. Maybe you can't settle your baby, you're not really sure, they can help. Maternal child health is, for babies and children. Nurse on call is for all ages. Just being mindful when you're calling these people, you're talking to them over the phone, so they can't assess your child. And so at times, because of the nature of, talking to someone over the phone, they can't assess them. So they will probably have a low threshold to send you to a doctor. But often they might be able to give you a bit of reassurance and a bit of education over the phone that can help make that informed decision, or give you a few tips of, oh, I haven't tried that, let's try that.
Yeah, amazing. Okay, so Nicole, we've talked quite a bit about fever. I would love to just ask you about breathing, but was there anything else you wanted to finish off with the fever side of things?
I think just reiterating to parents that fever is common, and depending on the age of your child, it's considered normal for a child to have between 6 and 12 viral illnesses per year. And a lot of the time with those viral illnesses, there will be a fever. It's particularly around the age group where babies and children start to be a lot more social, going to play groups and are out and about and start daycare and things like that. You may have heard it from...
It's right when you start work, isn't it?
Yeah. And that fever is okay. Fever is safe. Fever is not harmful. Fever does not cause a seizure. That's something separate that causes a seizure. There's a lot of old wives' tales about fever, that if your child has a high fever, that it will fry their brain or something will happen. They are all myths. We've got a lot of knowledge. We know a lot about fever these days, and the way that fever was managed 30, 35 years ago when we were children, or when I was a child, versus now is really, really different. We know that fever's safe and it's okay when your child has a fever. It's their immune system working well, heating up to fight off the bugs or the pathogen or the virus, whatever they have wrong with them. And so when your child has a fever, I really don't want you to panic. I want you to stop and look at the bigger picture of what is happening to them, and don't become focused on the number on the thermometer.
And that takes me to the question, what about something like paracetamol or Panadol to bring down your baby's fever?
Yeah, so paracetamol is a wonderful medication. It's commonly known as Panadol or Diamedon, that can be used to give to a baby to treat pain, discomfort when the baby's over the age of 1 month. And this can be useful to do exactly that, to reduce pain and to increase their comfort levels. So you wouldn't be giving paracetamol to a baby under the age of 3 months if they had a fever, to see if it comes down, because if they have a fever under the age of 3 months, you're taking them to a doctor. But perhaps you think that your baby is a little bit unsettled, maybe, I don't know, they have a bit of a runny nose, or perhaps after the immunisations are a little bit unsettled. You can absolutely give a dose of paracetamol that is really safe and really beneficial at increasing the comfort levels of your little one. My tip as a paediatric nurse would be to, when you're purchasing the paracetamol, so the brand, don't worry about the brand, but look at the flavour. There's lots of different flavours of medications, like strawberry, orange, cherry, vanilla, and think about what flavour you think you would like and what flavour that your baby might like, because it can significantly help with the compliance of the baby taking the medication. I know in our household, yeah, there's certainly a preferred flavour, and he's only 11 months old.
Go on, tell us, what is it?
Well, Ollie, my son, much prefers the strawberry flavour over any.
Same.
Yes, I think that strawberry is probably a winner for most.
The cherry one got spat out every single time.
Yeah, that's quite a common theme of as well, speaking to parents in the emergency department. And then the other type of pain relief that you can give is ibuprofen, which is commonly known as Nurofen or Advil, Benped, a few other things like that. That can be given to babies over the age of 3 months. And that, again, helps to improve their comfort levels, decrease pain. But ibuprofen, the same as us, is an anti-inflammatory. So thinking about if you feel like it's an inflammatory type pain, ibuprofen might be really helpful to give as well. When deciding what pain relief to give, you could give either, or you could give both. If your child was seriously hurt or really, really unwell, absolutely beside themselves, you can give both types of pain relief. So, say, for example, your child fell over and they broke their arm and their arm looks like a banana, you can absolutely give both paracetamol and ibuprofen. They work really well together. Or if your child was unwell, maybe they're at home with some sort of respiratory virus and they're miserable, you may alternate giving them. So you might be able to give a pain medication every sort of couple of hours. So doses of ibuprofen within a 24-hour period and 4 doses of paracetamol within a 24-hour period. We're just following the instructions.
Mum tip here, I would always, if I'm giving both, I have to write it down because it's every 6 hours for paracetamol, but every 8 hours for Nurofen, and it can get really confusing. So, my tip is to write it down.
Yes, definitely. You can get some different like fridge magnets and things like that. Penny from Sick has some amazing fridge magnets for that. The thing that I do is my husband and I both have iPhones, and we've got a shared note in our phone. So I just write it in there. So say one of us gets up to him during the night or whatever it might be, I'll just say, 04:40, whatever time. Of course, it has to be 24-hour time. And 2.5 mils of paracetamol or whatever it might be, so that then if he got him out of bed in the morning, he can check to see the most recent time. Definitely need. Yeah.
The question for you, I know with some of the adult anti-inflammatories and the stronger ones, I know they recommend having something in your stomach. So having, whether or not it's a cracker, just eating something just to help, because I think it acts upon the stomach or something like that. Is that the same with the baby ibuprofen? Like, do they recommend you give your bubs something to eat or even some milk or something to coincide with that?
Yeah, so interestingly, on one of the most common brands of ibuprofen, it doesn't actually mention anything about having it with food or milk. But as generalised advice, we would say where possible to have something in the baby's tummy, so maybe give them a quick breastfeed or a little bit of milk, something like that. If the child's really quite unwell and quite distressed, occasional doses of ibuprofen on an empty stomach is fine, but just avoiding it where possible. For example, in the emergency department, if a child's in significant pain, we wouldn't ask, is your tummy empty or have you had something? We would just give them both at the same time. But occasionally, yes, probably don't want to make a bit of a habit out of it for the gut health.
Okay, amazing. Thank you. I feel like we've covered fever really well. Let's quickly chat about breathing, if that's okay. I know this, maybe this is a huge topic and we don't have time to talk about it, but newborn babies' breathing can also be a bit of a scary situation. Is it true that they only can breathe through their nose?
Mostly, yeah. So if a baby, a small baby sort of under that 4-month time frame, if they have a blocked nose, it's really hard for them to breathe. And the reason why they breathe so well through their nose is that when they're sucking at the bottle or sucking the breast, when they're feeding, they can breathe through their mouth. So they can breathe through their nose. So if a baby has a blocked nose, if they're unwell and they've got, crusted over boogers on their nose, it's really hard for them to breathe. And you might see them, if their nose was blocked, really sort of gasping for air at times. And so that's why it's really important, if you do have a baby under the age of 4 months, that their nose is cleared out to help them to breathe, and particularly before a feed. So what we see happen in the emergency department, parents bring their babies in because they've been unwell with a cough or a cold and their nose is blocked. And because they've got a blocked nose, they can't feed, they can't take that breast milk, take that formula. And so therefore they're getting dehydrated and coming into the hospital. And what we do is we spray some saline up their nose and suck it out, and then the baby takes a feed. Parents are like thinking, oh my goodness, can we take that suction unit home? That's amazing. Don't always need to suction out their nose. Often using a bit of saline spray is sufficient. But yes, there
are little nose suckers, aren't there?
Yeah, there are. There's a couple of different types.
Do they work? Yes,
they do. Yep, I've got the Snotty Boss. We sell Snotty Boss on our website as well, and I've used that a lot this winter. I don't know how parents would survive without it, to be honest. I don't know if it's a nurse in me that I like making sure, things are clear and sucked out. But I know freaked out.
That is definitely the nurse in you.
I don't have any issue with it whatsoever.
How's your husband?
Yeah, he's pretty good. He doesn't mind doing it as well. I guess he sees how good it is and how effective it is. So yeah, he's fine.
How do you empty out that, what did you call it? Snotty Boss.
It's a plastic connection on the top of where the reservoir is, and you just empty it into the sink and rinse it out with hot water.
Yeah.
Don't leave it for a really long time because it might start to smell.
Oh God. Okay, let's move on. So that's actually a really good tip. I don't think I quite realised that in those. At what stage do babies start to breathe through their mouth?
At about 4 months of age, roughly, they start to breathe a lot more through their mouth. It's not to say that babies can't breathe through their mouth at all, but babies, at rest and most of the time only breathe through their nose. Like if it's a diet position, like I said, their nose is really blocked, they might sort of be taking a few gasping breaths through their mouth. They can, but as an overall message, babies are nasal breathers.
Interesting. And is that why a baby under 4 months with a cold is potentially a bigger deal than a baby over 4 months?
Yeah, I mean, the younger you are, the smaller your airways. It only need a little bit of inflammation for to cause more, symptoms for the breathing to be harder. Like even a cold in a 4-week-old is pretty horrible versus a cold in a 4-month-old. Whilst it's small, their airways are a lot bigger, and so that's 1 millimetre of inflammation in the airway of a 4-week-old is significantly higher than a 4-month-old. As they get bigger and they grow, the airways and everything gets bigger, so they become a little bit stronger too.
Yeah. Okay, I think I've got one more question. How do you decide whether or not to drive your baby to emergency or call an ambulance?
$1 million question. I get asked this in nearly every first aid course. There's a few things to consider. Things to consider are your location where you live. So some people might be really remote, quite rural, or they might live in a metropolitan area. Some people that live really remote, there's absolutely no way that they could drive. They would need air support. But for the most people that live within metropolitan Melbourne, things to consider are the distance to hospital. Could be any traffic, peak hour traffic, depending if you live in a city. Are there other children at home? Are you the only adult? Because if you're the only adult, we really discourage you from driving a baby that you feel is really unwell or that has breathing problems to the hospital on your own. And the reason why that is you can't safely drive the car in the front seat with the baby in the back and be keeping an eye on their breathing. It's just really unsafe. So the reason why I say if you're the only adult is because if you're at home by yourself and your baby is really struggling to breathe, then you need to call an ambulance. You can't safely drive them to hospital. It's not worth the risk. And if you've got lots of other children at home and you don't have someone that you can, immediately drop them at the neighbour or whatever that may be, that may also play into that decision-making process as well. But yeah, babies and breathing, you should have like a reasonably low threshold to call an ambulance if you're on your own. Otherwise, things like if the baby's breathing and behaviour is okay, then generally it's safe to drive them to hospital with 2 adults. But again, a very ambiguous answer to your question. It's really
That's okay. It's definitely helpful. So, Nicole, how can people come and find you? Where do they come and find you? And what do you offer? Like, what are your services?
Yeah, Yeah, sure. So you can come and find us. We are on Instagram, rhythm.firstaid. We have a website, rhythmfirstaid.com.au. And our services are, we've got a few different offerings. We've got first aid courses and we've got products. So within the sort of the course umbrella, we have corporate sessions that are customized to the workplaces. We have, myself and the other educators who are all nurses, we do guest speaking, we do nationally recognized first aid courses. So we teach first aid to ELC educators, for example, school teachers. And then we do infant and child first aid courses. So this is very much our bread and butter. We offer private first aid courses in homes for people in Victoria. And we also have public infant and child first aid courses in Melbourne and regional areas. And then we have products as well. So we have a family first aid kit that has been designed by myself and a team of health professionals that's made from sustainable timber. And then we have defibs, first aid, other first aid kits, medical supplies, lots of different things like snotty bosses, like health and safety items for your baby on our website as well. And with our first aid kits, we also, a part of that is that we can customize them for client gifts and corporate workplaces and parental leave offerings and things like that as well. They're fully customizable, so it's a nice, unique gift for someone.
Amazing. Thank you so much for joining me on the Pregnancy, Birth and Recovery podcast. I know we could have talked about a lot of different things and might have to have you back on for another topic.
Sure, love that.
Amazing. And I'll pop all your links in the show notes.
Awesome.
Thanks, Nicole. We'll catch you soon.
Thank you. Bye.
So that's it for today. Before I sign off, remember my team and I will be putting together the show notes for this episode with all the links, including how to connect with Nicole at fitnessmama.com/podcast. Have a fabulous day, and I look forward to you joining me next week for another episode of the Pregnancy, Birth and Recovery podcast. Thanks for listening to the Fitness Mama podcast, brought to you by the Fitness Mama freebies found at www.fitnessmama.com/free. So please take a few seconds to leave a review, subscribe so you don't miss an episode, and be sure to take a screenshot of this podcast, upload it to your social media, and tag me at Fitness Mama so I can give you a shout out too. Until next time, remember, an active pregnancy, confident childbirth, and strong postnatal recovery is something that you deserve. Remember our disclaimer, materials and contents in this podcast are intended as general information only and shouldn't substitute any medical advice, diagnosis or treatment. I'll see you soon.